Healthcare fraud in the U.S. is very big business today. In fact, in 2021, there were almost 60,000 cases that were filed about healthcare fraud, costing our country about $300 billion. And so in this video, I'm going to discuss healthcare fraud and specifically a recent case that came in Michigan where there were 23 people that were charged with defrauding Medicare of over $60 million. This press release just came out. Court documents were unsealed this week, charging 23 Michigan residents for their alleged involvement in two illegal schemes to defraud Medicare of more than $61.5 million by paying kickbacks and bribes and billing Medicare for unnecessary medical services that were never provided. An attorney that was in the case of this has alleged the defendants and their co-conspirators repeatedly paid illegal bribes and kickbacks so they could submit claims for medically unnecessary home health care services throughout the Detroit metropolitan area, exposing patients to needless physician services and drug testing and costing Medicare tens of millions of dollars. Now, there were two parts of this scheme. One scheme involved actually two people who owned and operated several home health care agencies in the Detroit area, and they allegedly concealed their ownership interest in these home health care agencies by using straw owners as well as family members and other work associates. They together submitted approximately $50 million in fraudulent home health care claims to Medicare. These two allegedly paid bribes to other co-conspirators to recruit patients in violation of the federal anti-kickback statute. The patients that were recruited did not need home health care, did not qualify for home health care under the Medicare rules, and in many instances didn't actually receive any kind of care, although Medicare was billed. These two allegedly entered into quid pro quo relationships, with physicians and physician clinics to receive the necessary information, medical information, to fraudulently bill Medicare. So based on their fraudulent claims, these two people received more than $43 million from Medicare, which of course they misappropriated for their own personal benefit. A couple others that were part of this had allegedly made illegal payments to patient recruiters and submitted false claims to Medicare. One of them was one of the straw owners of one of these home health care agencies. Another defendant was a registered nurse. This was a man, and he was employed by one of the home health care agencies, and he, again, allegedly and fraudulently billed Medicare for home health care services that were never provided, and then he falsely certified patients as homebound. And two others, these were the recruiters, and what they were doing is they would refer Medicare beneficiaries to these home health care agencies, and then they were able to bill Medicare even though the claims were not at all legitimate for reimbursement. That was one scheme. Now, the second scheme that was involved in this $61.5 million case it came about because of a doctor who operated a company that was called the Infinity Visiting Physician Services. And what he allegedly did was order that the physicians who worked for him to certify patients for medically unnecessary home health care services. And then he allegedly billed Medicare for services that were never actually provided to these patients, including 60-minute complex patient visits, obviously higher reimbursement rate for those, other services that were not medically necessary, including B12 shots and some other steroidal type shots that were necessary for people that would have them if it was after surgery, but it was not. And so that was fraudulent injections being billed. He also demanded that the physicians in his office order the highest reimbursement urine drug test for patients, obviously to get more money. And again, they were medically unnecessary. And then he would, of course, get a fee from the laboratory that would process those tests. And so as a part of this second scheme, the defendants billed about $11.5 million in fraudulent claims to Medicare. And so lastly, I just want to mention two other people part of the group were physicians, and then one was a licensed practitioner. And again, they worked for one of these companies, and they again provided unnecessary services to Medicare beneficiaries or submitted claims to Medicare for services that were not provided for patients. And so in all, again, 23 defendants, $61.5 million Medicare fraud, with the potential sentence for each of these people somewhere between 5 to 45 years. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. And so the point is this is just one of many, 61.5 million cases, one of many. Really, it's just the tip of the iceberg. Right now, they say that in America, we spend close to about $3 trillion in healthcare expenses, and about at least 10% of that is probably going to be fraud. So we're talking $300 billion of healthcare fraud today, and about 1/3 of that, $100 billion, that would be just for Medicare alone. All right. And so the question is, why is there so much Medicare fraud? Well, get this. Medicare processes more than 4.5 million claims per day. Not per week, per month, per year, per day. 4.5 million claims. And as you can imagine, it's often difficult as these claims come in, so many a day, to sort out through all the claims to figure out precisely which ones are real versus which ones are fraudulent. Now, all of us know how complicated healthcare can be, and especially the financial side of healthcare. Now, when we talk about the financial side of healthcare, it's referred to in our business as the revenue cycle. Revenue cycle. And so the revenue cycle begins when someone calls their provider, their doctor, their specialist, the hospital, whatever, and they actually make an appointment to get a healthcare service. And that healthcare cycle ends whenever that provider is completely paid. Okay, so from the call to when the provider gets paid, there's a lot in between. All right, and so it ends with full collection of any amount of money that's owed. Starts with a call. Well, this healthcare revenue cycle, one author said this, has many roadblocks, nuances, and can be quite the headache. There's billing hiccups, there's denials, there's patients that don't pay, there's insurance coverage that doesn't pay or expires. And so what we also have, in addition to those hiccups, people's sense of ethics and morals will often be degraded so they can line their own pockets. Happens all the time. And so what this does, all of these things lead to various forms of healthcare fraud. Now, what is healthcare fraud? We define it this way. It's an intentional deception or misrepresentation of fact that can result in unauthorized benefits and or payments. That's healthcare fraud. And there's all kinds of healthcare fraud, and I want to address a couple of these so that you're aware of them. Healthcare fraud happens usually because of poor morals and ethics by medical providers. It could be a patient, it could be a pharmacist, on and on it goes. But what I want to talk to you about would be, first off, the different fraud that happens today. What is generally happening is someone's bending the rules for their own personal gain. In other words, their moral compass is off. And so what's happening now, healthcare fraudsters are getting more and more creative, and their techniques are becoming more and more extreme. So let's discuss them. First off, as we look at medical provider fraud, those that are in the business, primary care doctors, specialists, hospitals, and such. Number one source of fraud is double billing. Double billing is when a provider submits the same claim for the same service more than once. So what the fraudster is trying to do is to trick the insurance company to pay for that same service more than one time, double billing. Also, in addition to that, there's a thing called unbundling. Again, healthcare fraud. And what happens here is when a healthcare entity submits multiple bills for the same service. And what this means is, unbundling means that a patient went in for a visit and they had multiple services done, but when this fraudster submits the claim, they're going to separate those as though this was not one particular visit. And so unbundling will involve billing for each step of a procedure as if it was a separate procedure when they knew full well it was not. Okay, that's unbundling. Then phantom billing, again, a big problem. And this is a variety of ways in which claims are fabricated. Phantom billing is what it's called. And this is, number one, billing for services that were never rendered, just something that were never given to a patient. Phantom billing happens when legitimate claims have charges for procedures or services that never took place. So this is someone that went in legitimately to see their doctor or some provider, and this provider had a reason to file a claim, but they add different codes to that to increase their billing. Okay, and so that's phantom billing. They're fabricating a claim. Another form of phantom billing is for billing a non-covered service through false pretenses as a covered service, which means they knew it was a non-covered service, but this person still needed needed it, so they're going to bill it as though it was a covered service. And this type of service fraud occurs when a doctor tries to obtain insurance payments by disguising the treatment they provide as a different medically necessary covered treatment. So they know this isn't covered, but they're going to bill it as though it was something that was covered and medically necessary. They say this happens a lot in the cosmetic surgery schemes. All right, and another one is interesting, called upcoding. Upcoding is a type of billing fraud where a healthcare entity falsely bills for a higher price treatment than was actually provided. So again, we got some treatment, but again, it wasn't the right one, so they upcode it. And so what's going on behind the scenes is this provider is actually inflating the patient's actual diagnosis codes. It's not the real code. They're inflating it for more money. So they'll falsely diagnose a patient and they'll bill the insurance company or Medicare for a more serious condition than what was actual. All right. In this example, a doctor would intentionally misdiagnose. Let's say that this is an elderly patient who is in a nursing home and they take a fall. And this fraudulent doctor will say there was head trauma, and they'll put that in the medical records. And with head trauma, there needs to be a CT scan and blood work done to see, the extent of this head trauma. And so this crooked provider didn't necessarily draw the blood or conduct the scan because it wasn't necessary, but still billed for those kinds of things. All right. And so they get extra money from that particular claim. Also, some fraudsters will actually perform, and this is terrible, they'll perform actually unnecessary medical services. And the sole purpose here, of course, is to generate additional income and payments from the insurance company to increase the provider's bottom line. And so, again, they're just adding things to it. So they do things that are unnecessary. Very sad. A similar scheme is when a doctor falsifies a patient's diagnosis and medical records. And they do this to justify the tests that they want to run and get paid for, surgeries that they may want to do and get paid for, and other procedures that really aren't medically necessary. So in this situation, unlike upcoding, where they're just simply raising it, they actually are providing a service that was totally unnecessary. All right, so those are very, very common ways that we see healthcare fraud today among the providers. Now let's talk about patient fraud. Again, probably not as extensive, but definitely a problem today. Now, patient fraud usually occurs when a patient is providing false information when they're applying for programs or services. This could include forging prescriptions or maybe selling prescription drugs, using one benefit you have, such as transportation, like on a Medicare Advantage plan, using it for a non-medical related transportation. Sometimes people loan out their insurance cards or use someone else's. That's patient-type fraud. All right. Now, patient healthcare fraud often occurs when someone convinces another patient to provide information for the fraudster's benefit, and there's normally a bribe or some kind of a kickback involved with that. For example, someone could offer a patient money to use their Medicare plan or use their Medicare card so that there can be billing for prescription drugs or other services. Fraudsters oftentimes will obtain personal health information from a patient so they can bill for non-rendered services, so they can enroll a patient in a fake health plan, or sometimes just steal their identity. All right, so a lot of identity theft. There's also a thing called identity swapping, and this is when a wrong person uses someone else's health insurance plan, and sometimes the patient knows it, and sometimes they don't know that. Another type of patient fraud occurs in the form of what's called impersonating healthcare professionals. So this happens when someone provides or bills for a healthcare service or maybe equipment when that person really doesn't have a medical license and the right to even do any kind of billing. And now let's talk lastly about prescription fraud. This is a big deal for this reason. 15,000 people die every year from prescription medication overdoses, 15,000 every single year, and that, of course, is growing. They say right now that these overdoses that occur lead to 1.2 million emergency room visits every single year. So that's why prescription fraud is such a problem, because people get the meds, they should be taking those, they overdose them, and now 1.2 million ER visits, 15,000 deaths occurring every year because of it. And so the abuse of controlled substances, obviously we know it's a serious health concern, and that's why pharmacies have to maintain constant vigilance against prescription fraud. So let's talk about fraud with prescriptions. Usually it's forgery. That's the most common, and this is when a patient creates or uses forged prescriptions. They do this by stealing legitimate prescription pads. They get those from physician offices. They steal the pads to write prescriptions for fictitious patients, sometimes for for themselves as well, so they can turn around and sell those. Prescription fraud occurs when someone gets a legitimate prescription from a physician, but they alter that. They add dosage, or they add frequency, or they add refills to that when they should not be doing that. Third type of forgery involves callback numbers. So many times the pharmacy is going to call back and verify that this prescription is legitimate. And so they'll alter the callback number. So it's going to go into a number where the fraudster is participating to make sure that prescription then would be okayed. And so that is also common. And then, of course, diverting, very common type of prescription fraud. This is when prescriptions that are legal are diverted for illegal use. This is someone selling their prescription medications. They really don't need it. Doctor prescribed it, so they're going to sell this to, pocket some extra cash. All right. And so those are the ways in which that occurs. And then lastly, it's called doctor shopping. Very common as well. This is where someone visits multiple doctors, multiple providers, so they can get prescriptions for controlled substance that they can either take and abuse or go ahead and sell. All right. And so those are the ways. So we're talking medical providers, we're talking patients, pharmacists, all these kinds of things lead to fraud. Now, recent article out, and this came out as a result of the new Speaker of the House, Kevin McCarthy, was speaking. And here's what he said. He said he wanted to eliminate waste in government wherever it is. Now, what's interesting about that statement is MedPAC, which is the agency that oversees Medicare spending and quality, is now bringing to his attention and to all of Congress new information now that is exposing another type of fraud, and that is hundreds of billions of dollars of fraud and waste in the Medicare Advantage program, which, of course, Medicare oversees.
Hey, my name's Josh Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the differences between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
The Medicare Advantage program is administered by corporate health insurance companies, and it was originally designed 20 years ago with the goal of improving quality of care as well as reducing cost in Medicare. Well, 20 years later, Medicare Advantage plans have yet to release complete and accurate data to assess the quality of the care that they provide for their recipients. And they know now that the quality of care can be questionable because of inappropriate delays and denials of coverage, when people are on Medicare plans. But also, the government knows now that Advantage plans are costing them more than what an enrollee would be if they simply stayed in the traditional Medicare program. Okay, so here's the point. Medicare Advantage program is plagued with waste and quality concerns for sure. Again, MedPAC, an oversight group, pegs Medicare Advantage overpayments, meaning money they should not be giving Advantage companies. They have overpayments for 22 and 23 to be somewhere in the neighborhood of about $44 billion. Some are estimated in the next 8 years, Medicare Advantage companies will receive over $600 billion in overpayments. Okay, and here's the problem. The Center for Medicare and Medicaid Services oversees this program, but they truly lack the tools, they lack the resources, and really the political will to drive meaningful accountability from the Medicare Advantage plan and protect the Medicare Trust Fund from all of this fraud. Okay, the Medicare Advantage plans have no interest in returning even a small fraction of the billions in unearned profits that they've received over the last 20 years. In fact, they'll say, we'll take you to court before we're going to return that money. All right. And so the whole point is the CMS has yet to identify the worst actors in Medicare Advantage plans, let alone cancel the bad actors' contracts. Now, one person suggested this, and I think this is very true, that the biggest and most fundamental Medicare Advantage fix would be to address what is called the risk-adjusted payment system, which is responsible for the wasteful spending and the questionable quality of care that happens with Medicare Advantage plans. This payment system, here's what they do. They entrust the Medicare Advantage companies by adding diagnosis codes to enrollee medical records to indicate their health status and their need of care. So these Medicare Advantage companies have the right to do this. They can add these diagnosis codes. Well, what happens? Well, that then allows unscrupulous Medicare Advantage companies to be overpaid and to defraud Medicare of tens of billions of dollars every single year. Recently, there was one such company that did this and got caught to the tune of $90 million. They were fined. And so this was a case that came out not long ago, and really it was interesting because it ended up being what's called a False Claim Act case, and it was against a company called Suter Health, and it came about because of a whistleblower, someone that actually worked for this company, and they were tired of all the abuse that they saw. I'm not going to tell you this lady's name, but her name was Miss O, and she worked for a company. Again, they had numerous affiliates with the Medicare Advantage system, and she saw that they were knowingly submitting false, inaccurate, and unsupported medical diagnosis codes. Remember, they had the right to do it, and this was inflating their reimbursements for the Medicare Advantage plan. Why is that? Well, the Medicare Advantage programs actually pay for care with a monthly payment to that Medicare Advantage company that is based on the health of the patient, as documented in medical records through the use of diagnostic codes, known as risk adjustment factors. Okay, and so this lady, Miss O, was one of the managers within this risk adjustment factor department, and she was witnessing firsthand over and over and again massive problems with their compliance with these RAFs, and she had serious concerns that they were submitting claims for reimbursements based upon false, incorrect, and unsupported diagnosis codes in medical patient records that were being added. And so she raised her concerns to the company numerous times. They repeatedly, though, rejected her efforts to bring them into compliance, and instead of taking affirmative steps to correct what they're doing wrong, they tried to stop her efforts to identify these problems. So when it became clear to this lady that this company was not going to reimburse the government for all these false claims, then she said, I'm going to get help. And so she hired an attorney. She went to the government Department of Justice, and she knew there was enormous fraud, and she wanted it stopped. And so she spent, along with her attorneys as well as the government, 6 years to investigate, litigate the case, and eventually this company agreed to settle for $90 million. Now, by the way, that's just a drop in the bucket. They probably could have received hundreds of millions, but they paid $90 million because of that particular case. And so we commend that lady for being a whistleblower and stopping some of the Medicare fraud. And so the whole point is this: you can see Medicare fraud is a widespread problem. Healthcare providers are guilty of it at times. Patients are guilty of it. Pharmacies are. Insurance companies are, for sure. Okay, now, just in 2021 alone, just to show you how big of a problem this is, 57,000, a little over, 57,000 reports of healthcare fraud in 2021 alone. Every year, they say right now, 12 million opioid prescriptions are illegally filled due to healthcare fraud. One of the biggest healthcare fraud cases just happened a couple of years ago, $2 billion fraud case, 600 defendants as part of many fraudulent schemes in this $2 billion fraud case. 165 of those were doctors and nurses. Okay, so again, this is a huge, huge problem. All right, I'm going to close with this. I found this to be very interesting. Since healthcare fraud is such a problem, there's several different strike force programs to try to find these people and charge them. So far, since these programs began back in 2007, there's been 5,000 people that were found guilty, and that group had collectively billed federal health care programs and private insurance more than $24 billion. All right, and so again, MedPAC, let me quote from them one more time. Again, they oversee Medicare spending. Here's what they said: we can do better and improve Medicare benefits while strengthening the Medicare Trust Fund. If we push for changes in legislation to eliminate the massive waste and abuse and root out the bad actors in Medicare Advantage plans, they say we would be able to make available hundreds of billions of dollars to rein in cost and help ensure everyone with Medicare is able to get the care that they need. And so I wanted you to be aware of this. It's a massive problem. What can you do about it? Well, there's actually a couple things. Number one, you could be a whistleblower. I commend this lady for doing that. This company was stealing from the federal government, and she really put her neck on the line and became a whistleblower. And I think she probably got something for that. Anything at about maybe somewhere between 15 to 25% of the case. And so maybe you could do that. Another thing you can do for sure is this. I'll give you 4 items. Number one, remember, protect your Medicare number. Okay, why? Because with that Medicare number, someone can make false claims, and fraud can begin with your information. So protect that Medicare number. Number two, record your doctor's appointments and services. Why is that? Well, I'm 62. I'm not yet on Medicare. I'm close, but my memory is not what it used to be. And so as you go to the doctor and get services, especially if you have a lot of them, write those down. Why? Because you're going to get a summary of benefit. You're going to actually get to see those claim forms. So that's number three, review your claims to make sure that you saw those doctors, those providers, and you got those services. And then if you see something that looks suspect, it just doesn't look right, then report that suspected fraud to CMS by calling 1-800-MEDICARE. So again, make sure you protect your number, write down all your appointments and services, and then go back and review those claims and report anything that looks suspicious to you. So as you can see, Medicare fraud is a tremendous problem. It costs us, the taxpayers, billions of dollars every single year. So I wanted you to be aware of it and be sure to understand how it happens, and you be sure to report it whenever you see it. Thank you.